I am Editor-in-Chief, Responsible Hospitals, and today I have Dr. Rohan Khandelwal, who is going to talk about his personal story and his personal life. So Dr. Khandelwal is a breast care surgeon and he's been teaching 50,000 students every year and he's creating a big doctor line. So hi Dr. Khandelwal.
Thank you.
It's great meeting you. So I just want to start with some random questions, doctor. Please tell something that how did you started with this journey of becoming doctor? How did this came to your mind?
First exposure to the operation theatre was when I was 3 years old. So my mother had taken both me and my brother to see a baby being born. And you know how fascinated everyone is to see a baby being born. And when she was doing the cesarean, my brother saw blood and he fainted. But I was, I was awestruck and I was just looking at the whole procedure. And I guess somewhere there I knew that I have it in me to become a surgeon in future. And after that I've been to the theatre. I went to the theatre multiple times with my mother. और एक बार ऐसा भी हुआ कि हमारे जहाँ पे हम रहते हैं a lady domestic worker was just taking a stroll in the park and she went into labor there. So I've even helped my mother deliver a child in the lawn. So those are the kind of experiences which I've had during my childhood. And by the time I was in class 11, I knew for sure that I wanted to become a doctor. And in first year of my medical school, I knew that I wanted to become a surgeon. So 2 or 3 instances. पहला ये हुआ था that I have a very close family friend, and her mother and her mother's real sister, they married 2 brothers, and they both got diagnosed with breast cancer when they were 35, and unfortunately they passed away before 40. So that was the first thing which exposed me to the field of breast cancer, and this is when I was in first year of medical school. Also, when I entered second year of medical school, my surgery professor, he was a breast cancer surgeon, and we used to treat a lot of breast cancer patients with him, and I did a lot of research also in my undergraduation. So uski wajah se I was very clear that when I become a surgeon, I wanted to just focus on this branch. Also because us time pe koi bhi dedicated breast cancer surgeon wasn't there in the country. Okay. Everyone was doing everything and saath mein breast cancer. But I have from day one restricted myself to only breast cancer and breast related diseases. So initially things were difficult, because when you're just restricting yourself to one organ, but over the years it's been a very satisfying journey, and I'm very happy with that. So there are a lot of surgeries which all surgeons remember, but कुछ special cases होते हैं. So for me, one of the special cases was my first gunshot injury patient at Sabdarjung. So this was when I was in my first year of post-graduation, खत्म होने वाला था, and we were on emergency duty, and there was a person who was carrying his gun in his pocket without a safety, and he accidentally he discharged his weapon. तो उनका जो ये बोन होता है साइड में, वो बोन को पियर्स करते हुए the bullet went into the stomach and it exploded into those fragments again. So when we opened the abdomen, there were 56 of those chhadas which we recovered, and there were 12 places where his intestines were injured. So that is one case which I can never get out of my mind.
Okay, but what was the feeling? When you came out and you did the surgery, and was it? Were you recalling that incident again and again at your home? Were you sharing it? Were you happy about it? That you have resolved it?
Yeah, once you do this kind of surgery, you do discuss it with your peers. You come back home and you discuss it with your family as well. But the really gratifying moment is when the patient recovers and goes home. So the day the patient got discharged from the hospital, that was the real high for me. Because it's one thing to do the surgery, but at the end of the day, you want patients to get well as well.
Sure. And how many surgeries almost we have done so far?
It'll be difficult to count how many surgeries I've done, but on an average, if I talk about my practice right now, in my breast cancer surgeries, I'm almost doing 30 to 40 procedures a month.
Wow, this is absolutely great.
Right, so that's a good question. So one of the reasons for taking up this branch also was that in breast cancer and breast diseases, there aren't many emergencies which come up, right? So most of my work is elective surgery work, and this gives me time for my extracurricular work. Like I like to teach, and of course, I like to play cricket and hang out with my friends. But most importantly, spend time with my family. So. We were blessed with a child last year, so Corona has been a blessing for me because I've got to see all her milestones in the last few months, and I've spent a lot of quality time with my family during this period. But yes, this is one of the perks of my branches as well, that I don't have a lot of emergency cases.
That's awesome. And since I've just read that your wife is also a doctor, so when you go home after doing surgery, and she's also a doctor. And everybody would want to know that what kind of discussions you usually do. Do you talk about that, you did meet such kind of patients, or you had such kind of experience in surgeries, or you have some other chit chat?
So we both were batchmates at Sabdajan, undergraduate batchmates, and so we both joined our post-graduation together as well. And she was in pathology, I was in surgery. So whatever we cut, we send it to the pathologist for examination. So a lot of times our dining table conversations were about cases, what we've done during the day.
Okay.
But now, of course, she is more involved in raising my child, although she also interacts with almost 50,000 doctors. She also teaches every year. But these days, of course, the discussions are regarding her daughter. And,
awesome.
Yeah.
You also have something like this for Rohani, that you want to raise a doctor again?
No, I mean, we are very clear. She will become what she wants to become, and we will support her in everything. We are not going to force anyone to become a doctor. If she wants to become a doctor, we are there to support her. If she wants to become an artist, we are there to support her.
Awesome.
Well, so my surgery professor, who was my mentor also, he used to always say that, always keep on thinking about new things, right? Don't settle down. And he always used to say, the only thing that settles is dust. So, goals keep on changing as we progress in life. But if I have to talk about in general, I want to create a society which is more aware of breast cancer. The taboo regarding cancer has gone to quite an extent over the last few years. When I started off 12-13 years back, there was a huge social taboo also. That is gradually going away. Awareness is increasing. But we would want that this awareness percolates down even to the rural levels, and we can pick up cancers early. So on a professional level, yes, that would be my ambition. On the other hand, of course, whenever I interact with these budding students and doctors, they also teach us a lot of lessons. And to see them grow right from their undergraduation to becoming consultants now, it's very satisfying for a teacher. So yeah, these are the things which I really want to grow in future. But in terms of goals, they keep on changing. I won't be satisfied with just achieving one thing. So I mean, these are unprecedented times, and everyone is scared, and rightly so. We know that we have to treat patients as well. We have a sense of responsibility towards them also. So we are taking all the precautions. As you must have seen in the hospital, there is very stringent screening which is happening outside, and we are wearing our proper gear, the PP gear we are wearing regularly. So if we are taking all the precautions, I think so we are fine when we go and meet our family. So it's just that I must be washing my hands almost 100 times a day. When I'm here, I'm always using a hand sanitizer. So those are the kind of habits which everyone needs to develop, and if they can do that, then we can reduce the transmission to a great extent. I think so at the end of the day, I can't stay away from my family. So we are taking all the precautions. God forbid if I do get exposed, then of course I'll isolate myself. One of the most happiest moments for a teacher is that when a student messages you and says, "Hey sir, I also want to become a breast cancer surgeon," right? And just this morning I had 2 such messages. from students, right? A guy and a girl, and that is the happiest moment for you. So I am guiding these students on a regular basis regarding how to go forward and how to pursue this branch. What are the challenges which you face, and how did I overcome them, so that they don't have to face them all over again. They can probably start working on them from day one. Like when I took up this branch, सब लोगों ने कहा कि आप मेल हो और इंडिया में फीमेल्स आके आपको चेकअप नहीं करते. To the extent that even my parents said that this is going to happen. But over my last 13 years, I can just recollect 1 or 2 patients maximum जिनने कहा कि that we want a female. Other than that, if you counsel them properly, if you talk to the patient properly, they have no issues, whether it's a male doctor or a female doctor.
Obviously.
So these are things which I guide them. I guide them how to connect with patients, how to stay in touch with patients. Because breast cancer is not कि मैंने surgery कर दी ठीक हो गया. That patient remains your patient for lifelong. As you can see here, these are some happy memories which we have. We have a cancer support group called Vijay, and we meet every 3 months where we all celebrate victory over cancer. We listen to all the stories which these patients have, and these patients then help out newly diagnosed patients. Sure. And that is also such a good thing to see that जब ये लोग हमारे पास आए थे, ये कितने anxious थे पहले दिन पे. But now once their treatment is done, they are so confident कि वो दूसरों को भी guide करते हैं. And that's how we can educate people, create more awareness, and in general help patients. Because just physical well-being is not important, mental well-being भी बहुत ज़रूरी है breast cancer patients.
Sure. Thank you so much, doctor, for giving your valuable time, and it was great interacting with you. I'm sure with these thoughts, a lot of people will learn to become doctors like you, that they have done so much for the society and really doing a lot for the clients, and you have given, a lot of survival to them. So thank you so much.
Thank you very much.